Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Upper lid blepharoplasty. This is an upper lid eyelid tuck. It's a procedure to remove the skin and fat from the upper eyelid, and it's designed to reveal what's called the lid show, the area of the eyelid immediately above the eyelashes. This is the area that you place the eyeshadow on. Many patients complain of having to lift their eyelid to place the eyeshadow, or mascara getting stuck on the skin fold. Blepharoplasty surgery aims to help deal with these issues. What does blepharoplasty involve? It's generally a day case procedure performed under local anaesthetic, although some patients prefer a general anaesthetic. The procedure involves an injection of local anaesthetic into the upper eyelid, removal of a layer of skin. Sometimes it involves removal of the fat and then resuturing of the skin together. Although it sounds quite simple, it's technically quite challenging because even 1 millimeter difference can create significant abnormalities to the appearance of the eyelid and, in rare cases, functional problems to the eye. After the surgery, you'll have some tapes on the eyelids. You'll have some ointment to place over the incision, and there's usually one stitch in each eyelid that's a pull-through suture. This is removed at around about 5 days. You come into the clinic and the suture is gently pulled out through the eyelid in that manner. Sometimes more than one suture is needed in order to align the skin properly. After the procedure, you'll have significant bruising and swelling of the eyelids. These photos show typical recovery. Although some patients have much worse bruising and some patients have less. In order to hide traces of the surgery, you'll need to take at least a week off work, sometimes 2 if you spend a lot of time facing the public and want to be sure that people don't notice you've had surgery. Even at 2 weeks, there'll still be some puffiness around the eyes that you only should notice. You may wish to wear sunglasses for a week or so after the surgery to hide the obvious traces and bruising. And after the surgery, there'll be a tightness around the eyes that will be unusual but not uncomfortable. Complications related to the surgery can include the scar being placed not within the crease of the eyelid or being visible. The scars of the eyelid usually heal very well, but sometimes can be lumpy, can be red, and can be visible. Scars will be carried out into the laughter line area here if needed in order to remove a hooding of skin more laterally to the eyelid. Theoretically, a keloid scar could form, a big thick lump of scar tissue. I've not seen this in eyelid surgery, but it is a possibility, and if it does happen, would require referral to a specialist. Infection can occur at the incision site and has the risk of around about 2% or so. It would be very rare for it to be more than something that can be dealt with oral antibiotics, but something called periorbital cellulitis could occur, and this is a severe infection around the eye. I've not seen this following cosmetic surgery of the eyelid. Bleeding can occur after surgery and initially is manifest as bruising. Bruising can be significant, but in the majority of cases is similar to blackness and blueness around the eyelids. It can sometimes track to just below here onto the cheek. Very rarely you may get significant bleeding around the eyelid, causing swelling, blood to come out of the incision, discomfort, and severe bruising that lasts several weeks. There is also a very rare form of bleeding within the eye socket called a retrobulbar hematoma. The risk of this is approximately 1 in 2,000. A retrobulbar hematoma can cause significant pain around the eye and would be noticed by deterioration in your vision at the later stages. However, pain is the most obvious symptom that you would feel, and it's significant. You would be wanting to come back to see a doctor quite urgently. If left untreated, then this could cause blindness, and the risk of this is far less, I think around about 1 in 22,000. Blindness as a consequence of retrobulbar hematoma is avoided by returning to the hospital promptly if you have concerns, and if necessary the incision will be opened on the ward as an emergency. This is not as painful as it sounds. This will relieve the pressure on the eyeball, and then you can be taken to theatre safely if necessary. Once you've been returned to theatre, the area can be washed, cleaned and resutured, and the bleeding stopped. Another complication would be upper lid malposition. This would be manifest by, for example, taking too much skin or damage to the mechanism that opens the eye. The latter is rare. Taking too much skin away is unusual. I'm very conservative. It's much easier for me to leave a little bit of skin behind and for you to come back saying you want more removed than to take too much skin and then for you to require reconstructive procedures down the line. Nonetheless, you will feel tight around the eyes, and in the first week after surgery you may not be able to fully close your eye, and this is primarily due to the swelling after surgery. In rare cases, should too much skin be taken, then you may not be able to close your eyes properly, and this may result in what we call ocular surface symptoms, dry, itchy or watery eyes. Asymmetry is always going to be the case after surgery. There will be minor, noticeable differences that you will realise after the surgery. These are within normal limits and should be no different than any differences between eyelids of somebody who hasn't had surgery. You may get ocular surface symptoms occurring, such as dry, crusty, red or sore eyes. These are due to imbalances or due to changes to the tear film and may occur after surgery. A thorough ophthalmological history will be taken before the surgery to exclude any of these symptoms or anything that would predispose you to these symptoms. I may refer you to an ophthalmologist if necessary before surgery to ensure that performing such surgery is safe. Double vision may occur. This can occur if damage to the muscles that move the eyeball is sustained during the procedure. In upper lid blepharoplasty, generally we don't go near these muscles, but accidents do happen and even the finest surgeons have had complications, and for this reason we need to warn you about them. Sometimes you can get swelling on the eyeball itself called chemosis. One patient has described this as frog spawn. It looks like bubbles on the eyeball itself. In the vast majority of cases, this will settle down on its own. Occasionally it may require steroid eye drops. Surgical intervention has also been reported in the literature. If you have the procedure under a general anaesthetic, then there is a small risk of a DVT. That's a clot on the legs or deep vein thrombosis. But this surgery in itself is very low risk for such a complication. Aesthetic complications include you may feel that the surgery has been overdone, so you've overcorrected. The surgery has not done what you intended, it's undercorrected, that there's too much skin left behind. You may feel that you're unhappy with a result that is otherwise technically a good result. In this age, when people are taking more photos than ever of themselves, you will always find an angle, a lighting, a photograph where your eyelids don't look perfect. Surgery cannot make you look perfect at every angle all the time in all situations. So in spite of the surgery improving your appearance, you may still find that you have dissatisfaction in certain angles. That is normal and there's nothing that we can do to stop that. In upper lid blepharoplasty, changes in eye shape occur especially when a hooded piece of skin is removed, and sometimes somebody's eyes look rounder than they were before. This is because the hood of skin gives the eye a pleasing almond-shaped eye, but when the skin is removed, the underlying round shape of the eye remains.